Namaste. I am Dr. Shantakumari from Mada Ayurveda Eye Hospitals, Thiruvananthapuram. Today I want to talk something about proliferative diabetic retinopathy. Because people used to ask me whether there is treatment for PDR in Ayurveda. So it is a tough question. Simply I will say yes, there is treatment for PDR in Ayurveda. But before coming to the topical result, we have to know something about PDR, and before that, DR, that is diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that everybody knows, and there are different types of diabetic retinopathy. That means different clinical stages or different classifications like that goes. And PDR is one among them. Mainly diabetic retinopathy is classified into two, PDR and non-PDR. That is non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Among these two, pathologically when we think of it, this proliferative diabetic retinopathy is more serious than non-proliferative type. Here, that means in PDR, the main changes are in the vessels and its later complications. The blood vessels are damaged. There will be the texture of the vessels are damaged, and as a result, there will be leakages from the vessels. Vast hemorrhages may happen, and as a result of hemorrhage, there will be some hypoxic area beyond that because of no blood supply. So, to compensate this hypoxia or deficiency of oxygen, collateral vessels will develop. Just like in any other part of the body, there will be development of new vessels and ascending to the hypoxic area. So these vessels are usually very not healthy in some way. So it bleeds again. Then again new vessels, collateral vessels develop. Like that, there will be a possibility of network formation, network of vessels on retina. This is a very dangerous situation. Then that is one fact. Then in sometimes this vast hemorrhage, and as a result it may penetrate into the vitreous gel and it will be transferred into clots. It is very difficult to drain out the clots from the vitreous gel. So then there is no possibility of further repair, and so sometimes vitreous gel is altogether drained out, removed, vitrectomy, and a new fluid, synthetic silicone fluid is filled. That is what is happening nowadays. So that also is a tough condition. And sometimes what will happen, the vitreous may detach from the retina, vitreous detachment. Or sometimes there will be also possibility of retinal detachment. The outermost layer may detach from the inner layer. Like that, there are so many complications that may happen as a result of PDR. So, since the pathological change is different and the signs and symptoms are different, the treatment also varies. So, the result also varies. So, in a condition of hemorrhage, the result will be one type. That means it will be to arrest the bleeding. And if it is more clots, we have to drain out the clots or to melt it or to dissolve it and drain out. And in the case of detachment, we have to stick on to the basement membrane. Like that varies. So, the first and foremost factor is to have a differential diagnosis. Actually, what is happening in the retina and what is the pathological change. Accordingly, we have to plan, we have to chart out a line of treatment. That is the approach in Ayurveda. For a PDR, this is the treatment, or for an NPDR, this is the treatment. That cannot be said according to Ayurvedic principles, because in each and every step of these changes, the involvement of basic dosha, according to Ayurveda, dosha changes. Dosha means the functioning element or the functioning factor of the eye. Generally, it is said about Vata, Pitta, Kapha. These are the three elements and its combinations. And in the case of PDR, Pitta is the dominant factor. So, the aim of the treatment will be to control or to Shamana Chilsa, we will say in Ayurveda, the Shamana of Pitta, or to maintain Pitta, or to maintain the qualities and properties of Pitta. That will be the main aim of the treatment. And according to the particular condition, there will be changes in the selection of medicines. For example, if there is a hemorrhage, that is the main thing, some properties Pitta is vitiating. That means maybe flowing properties, Sara, or thinning of the blood, like that. That is confined to Rakta or blood itself. So we have to control these vitiated properties. For that, one particular group of medicines are to be selected. That will be controlling Pitta, but particular properties of Pitta only. For that, there are some specified treatment procedures also. For example, Shirodhara, that is continuous pouring of medicine over the head, and then Netra Sega means in the same way apply medicine in the eyes, and Vidalagam means to apply medicine on the eyelid, over the eyelid, like that. Some procedures are there, and for these procedures, the medicine selected should be useful for the management of Pitta. That will be the line of treatment in a severe hemorrhage. In general, we can say Rakta Stambhana means arresting the blood flow or the flowing of blood. But in the case of clots, if it is too many clots in the vitreous or on the retina, then we have to melt it or to dissolve it and drain it out. For that, the treatment, the aim of the treatment will be entirely different. Okay. So there also the main factor is Pitta, but the properties vitiated or the pathology developed is different. So there we have to maintain or bring back the properties of the flowing property or the fluidification of that type of property. We have to maintain it, bring back that property. For that, another group of medicines are necessary, another group of treatment procedures are necessary. For example, this Anjanam means apply medicine on the eyelids, just like a collyrium or kajal, like applications are there, and eye drops are there, and nasal drops are there, and also Shirodhara, apply medicine of the head. But the medicines and the drugs will be different. Procedure same. So, that means in the case of removing the clots, the treatment methods and the medicines will be different from that of a stage of hemorrhage. But both are included in under the term PDR. But the treatment varies. Again, in the case of detachment, the treatment line will be again different because we have to attach. There also Stambhana is necessary, but not Stambhana means attaching type of property. For that also medicines are there, treatment procedures are there, but different from that of the previous two types, hemorrhage and clots. Here also Shirolabhanam means applying medicines over the scalp in a uniform way, and apply medicine over the eyes in this uniform way, and then apply Netra Tarpanam, that means fill the eyes for the calculated time in the eyes. These types of medicines, this type of procedures are very useful in the case of detachment. And for that also the medicine should be highly selective. Not a single medicine is not enough. So there also the procedures and the medicines varies from that of hemorrhage or clots. Like that, we have to analyze each and every change, what was happening in the eye. Accordingly, we have to select the treatment procedure and also the medicine. That is the success of the treatment. Without having a differential diagnosis and without understanding what is the pathological change actually happening in the eye, we cannot follow a treatment. So, if a experienced hand is taking the case and taking a differential diagnosis, then a perfect treatment is possible, and then we can protect the eye and save his vision. Okay, so diagnose in the time and take the treatment in time. That is the basis of the success. Okay. Thank you for hearing me. I am Dr. Shantakumari from Mata. Thank you.